Are you using the right sunscreen? Are you putting your products on in the right order in the morning and at night? You don't want to miss today's interview because today we're going to talk about skincare.
This is Charleston Women Podcast, where you can meet like-minded, strong, independent, professional, and inspiring local women. This is Charleston Women Podcast.
And now we'd like to welcome to the Charleston Women Podcast, Dr. Tom Scharnitz, who is a board-certified dermatologist with the Dermatology and Laser Center of Charleston. Doctor, thank you so much for your time today. How are you?
Great. Yeah, thanks so much for having me. I'm excited to talk about all things dermatology.
Yes, we are excited to have you. And I know our listeners are eager to talk about skin health, especially sun. We're going to get into that in just a second. But I just want to start with a general overview. You know, as a dermatologist, what kind of things do you treat? Like, I think we have an idea, but you probably do more than we realize.
Yeah, so I think a lot of people tend to think of dermatology as the things they see on TV, which it is a lot of that too. So we have a lot of general visits where people just come and want to talk about general skin health, sun protection. That's one of the more common things. However, we treat everything from benign and precancerous as well as cancerous lesions, rashes, anywhere from psoriasis to eczema, basically anything you can imagine. And then also, I think one thing that tends to be misunderstood about dermatology is we can do surgery and procedural visits as well. So that includes removing cancerous lesions or precancerous lesions, but also procedural visits such as Botox, fillers, all those kinds of things.
Right. All the things to keep us young, right? Keep us looking good.
Absolutely.
When you listed all kinds of stuff, what would you say is the most common reason people come to you? Is there one that you can pick?
Yeah, it's interesting. I mean, I think it depends a lot on age. Being in the low country with a lot of sun exposure, and light-skinned individuals tend to come for skin checks with a lot of sun damage over the years. However, we diagnose and treat skin conditions in all skin types, from the lightest skin possible to the darkest skin, from oily to dry. I would say a lot of our younger patients come in for acne or new rashes. There's a lot of variation throughout the day, which really helps keep it exciting. So.
Right. You guys years ago helped my little one. She had a wart, which I guess they're common on the playground. Who knew?
Yeah, very common actually.
You treated it. You gave her some magic gas or something. And she's very pleased. Thank you for that. You mentioned skincare or skin cancers. On a more serious note, what is the most common that you're seeing, especially in this area?
So across the board, the most common is something called basal cell carcinoma. It is named for carcinoma meaning cancer, and basal cell is a specific cell in the skin. There's about 3.8 million new diagnoses per year. And if you've had one, you're more likely to form another. The second most common is something called squamous cell carcinoma. And, when people think about skin cancer, the one they're most accustomed to thinking about is melanoma. Much less common, but much more concerning. The other two, the basal cell and the squamous cell, they tend to remain in place. It's not as common that they would spread elsewhere, which is also known as metastasize. However, they can be locally aggressive and they can keep growing. So really with any skin cancer, we want to catch it early. The earlier you catch it, oftentimes it's thinner, it's less aggressive, it's easily treated. And then thinking about melanoma, which I briefly mentioned, again, these are the ones that people tend to think about when they think skin cancer. And that has a much higher risk of spreading deep into the skin. And the deeper in the skin it is more likely to spread elsewhere throughout the body.
Right. I know I've talked before with you guys. I think it's the ABCDEs of melanoma. Right. Is that right? All the way to
Absolutely.
E. Give us some pointers about what we should be looking for, when we look at ourselves. What are the warning signs?
So the ABCDEs are definitely a good starting place. Going through each one, it stands for asymmetry. So I always tell people if you can kind of cut the mole in half any which way, it should basically mirror image itself on the other side. So if it's asymmetric, it's not doing that. Border, jagged borders, irregular borders. We like our moles to be nice and round and the same color. Leading into the next one, which is color. Multicolor or very dark colors are the ones that tend to be a little more concerning. Leading into D, it's diameter. I tend to tell people bigger than the size of a pencil eraser, which is about 6 millimeters. And then evolving is the one that people commonly talk to us about. So anything changing over time. Two other things I tend to like to add into there. I sometimes will add an F, which stands for 40. So although it's not impossible to get new moles after the age of 40, it is definitely less likely. We tend to form most of our moles when we're young, and we tend to lose some even as we get older. The last thing too is the ugly duckling sign. It really stands for when you're looking at your moles in the mirror or having someone else look at them for you, which one really stands out among the rest? People tend to make moles that look like one another. So if you, for instance, have 50 light brown circular moles and all of a sudden a black, kind of irregularly shaped one comes out, that's definitely one we tend to not care about more, but deserves a little more attention. And you should probably see a provider at that point to get that checked out.
Podcast advertising is the new way to reach your best audience. Podcast advertising gives your business a voice of authority. Be heard. Advertise on one of our podcasts. Visit carolinapodcasts.com or call 843-345-7012.
You're listening to the Charleston Women Podcast.
I know I'm overdue, as I'm sure many people are, with the pandemic, and we haven't seen like our regular checkups. How often should we go for a skin check?
So I'd say for most people that do not have a history of cancerous or precancerous spots, after the age of 30 or 40, probably once a year, I think it is good to establish care early, especially in folks that do have a lot of sun damage over the years. So I tell people, come in if you're concerned about anything, establish care with a board-certified dermatologist or dermatology provider. That way, if something does arise in the future, it's much easier. You have that relationship. You can even just call on the phone and ask if you should come in. So I think establishing early, and then for most people, once a year tends to be good enough.
Okay, so what can we do to minimize our chances of developing skin cancer? What would you tell any of your patients?
So I think a lot of people, especially in this area with a lot of sun exposure, know sunscreen is very important. Some people have different thoughts about sunscreens. There are some that are chemical that can theoretically be absorbed into the blood. There are a lot like zinc or titanium, which are physical barriers. They sit on the top of the skin and are not absorbed. But really thinking about just sun avoidance in general. I tend to tell people as well that, you don't have to live in a cave. You can go out, enjoy the sun. It's good to get vitamin D. Really trying to limit direct sun exposure to less than 15 minutes. Darker skinned individuals do have a little more natural sun protection, but as well, you can definitely get burns and skin cancers in darker skinned individuals too.
Right.
So I often recommend clothing is the best thing you can do. Long sleeve clothes, wide brimmed hats. Obviously it's a little hot for that. Shade seeking activities as well. But really when it comes down to it, just thinking about the direct sun exposure you're getting throughout the day.
Right. You said less than 15 minutes, but let's be honest, like that's hard in Charleston, South Carolina, to minimize our sun exposure at the pool, at the beach, on the boat to less than 15 minutes. So if we are a little more realistic about the lifestyles that we live, you recommend a rash guard, like the big hats, those steps.
100%, yeah. Yeah. And I probably misspoke a little bit. Less than 15 minutes without any sort of sun protection.
Okay. That makes me feel better. Okay.
A little more reasonable there.
Right. When it comes to reapplying, I've heard before, is it every 2 hours? Does that still hold true that we need to put more sunscreen on?
Typically, yeah, between 90 minutes or so and 2 hours is a really good timeline to remember.
Yeah. I want you to be completely honest with me. I use the spray sunscreen because we have kids and it's just easy just to spray them down. Is that a bad choice? Should I be using something better? You mentioned the zinc and the mineral based. Is that a better option? And when it comes to spray versus the cream, which we all know takes longer, what's your preference?
So I think it really comes down to personal preference. The best sunscreen is the one you use. There are some safety concerns that have arisen with some of the sprays containing benzenes. I'm not an organic chemist, but some of those, may contain like aerosolized things that are not the greatest for the environment or for your skin. But really, if you are going to use a spray, make sure that you rub it in afterwards, because it does leave little areas that are not totally covered. But it really comes down to, which one you're most comfortable with. Which one you're going to use tends to be the best sunscreen. So.
Right. As women, we all look better with a little bronzed glow. You recommend to get it from a bottle. Like we should be using our fake tanners, right, than laying out anymore.
Yeah, that's definitely safer. And there's obviously variations in skin types. Some like darker skin tones tend to tan as opposed to burn. It really comes down to your skin type and personalizing your skin care to your skin type. And I think that's why it's so important to follow with a dermatologist to really get the most accurate information, because there's a lot of information out there. We all can Google and find 2 million results in 10 seconds, but
There's a lot of misinformation out there. I'll go ahead and say that. Let's talk about, we talked about sunscreen, but other products and stuff. I think women sometimes, I'm up for trying anything if it says it's going to make my skin brighter and better and going to make me look younger. But sometimes instead of just dabbling and trying to figure out on our own, we should see you, right? We could get the skin exam. You could recommend products that are best for us.
I think so. I think the challenge these days, it's a big business, skincare, and a lot of the products you'll find online are overpriced, or even if they're not overpriced, it's not tailored to your specific skin. Again, you can have dry skin, oily skin, very sensitive skin. So seeing a dermatology provider is best. And I think one of the challenges too is oftentimes online, just like with Instagram and Facebook, you're seeing the highlight reel. You're seeing celebrities that have professional makeup artists. They're putting filters on. They're doing a lot more to their skin than just using the product they're advertising. So I think remembering it's a business and trusting your skin needs to someone that has trained for years and years to figure out how to appropriately treat every patient is best.
Right. They're saying like one cream is miraculous, and really they've had lasers and all kinds of things, right?
Yeah. And also the photos you're seeing, the before and after, that may be 1 out of 1,000 patients that had a really good result.
Right.
And a lot of times too, you don't know if it's retouched, or again, the age of Instagram with filters, you don't know what has been done to that photo. So
does it drive you nuts as a professional to see Instagram and all these perfect skin that is not real?
I think what drives me nuts is when some companies are not very honest with their advertising. I do think there are some good products out there that you could stumble across on your own, but often stumbling across the correct product for you takes a lot longer than if you see a professional that can really get you there quicker and more affordably. And again, establishing that relationship, because a lot of skincare is for people trying to look better, but also there are a lot of skin needs that may arise in the future. So if you have that relationship, it's good.
Right. I know you're limited on time, but I want to ask you one more question before we wrap this up. And I struggle with it. Like, there's so many products that you can use. I never know the order. Like, do you put the serum on first or the sunscreen? Like, do you have a basic products that we should be using in the morning or nights? Like, what's your expert opinion? In what order do we put them on?
Yeah, quite often, I tend to keep things simplistic for the vast majority of patients, and then again, tailor it specifically. But gentle face washes, I think there's a common misconception: the harder you wash your face, the better it's going to be. That often can create inflammation and make the skin worse over time. So a gentle face wash, a moisturizer, and then a sunscreen in the morning. A lot of moisturizers do have sunscreens in them, so it's kind of 2-for-1 deal. And then at night, the same thing, just very gentle skincare. And if you're going to use something such as a serum or a retinol, typically those are at night, but oftentimes, that's third in line after the other things.
Right. Do you recommend at what age should women start using a retinol, or is it not for everybody? We should see you and have you let us know.
For sure.
The right choice.
Yeah, I think you predicted my answer, but retinols are good for most people preventatively. There's retinols and there's retinoids. Retinoids by rule tend to be prescription, tend to be a little stronger, but also a little more harsh. So I think the challenges I've seen with some people are they buy these products over the counter and they overuse them to begin with, and it can be really harsh on the skin. There's, to a degree, not ever a time to start too young, but it's important to remember too, a lot of those different medications are contraindicated in pregnancy and breastfeeding.
Right.
So I do, again, as a general answer, I think see your dermatologist and discuss with them before starting any skincare regimen.
Doctor, where do we see you? I understand you're at the Somerville office, but you guys have a couple locations.
Correct. Yeah. 2 of our locations are in West Ashley. Our original location is in Henry Tecklenburg Drive near Lowe's.
Right.
Our more research-oriented location, where we still do see patients, is 5 minutes away from there. I'm currently solely at the new Somerville location in Nexton Park. We're right across the street from Hall's Chop House, so it's a good way to remember where we are. There's a ton of new buildings every day. There's a lot to see. So a lot of times patients will come see us and then actually explore the area too. So it's in a really great area.
Go to Hall's when you're done. Get a good dinner. Your website is dermandlaser.com. What is the wait time? I know sometimes it can take a while, especially if you're a new patient, to get in, like if I want that initial skin check or consultation.
I think the great part, one of the small silver linings of the pandemic was that our office didn't get as busy as quickly. So we still have For serious rashes and very serious concerns, same day availability. For any other just kind of acne or common skin check, at this point at the Nexon location, we can probably get you in the same week.
That's great.
We are filling up over time, but again, having a new location and unfortunately the pandemic kind of keeping things shut down for a while, the one benefit of that is that we still have availability to see patients pretty quickly. So,
all right. Dr. Scharnitz, thank you for your time today. Is there one thing that you want to leave our listeners with, one tidbit or piece of advice that you really wish people would take away from this interview?
Yeah, I think it probably shone through in some of my answers, but trust your dermatologist. If you have any questions, if there's any skin findings, just call and make an appointment. I think the one thing I tend to tell people very often for our established patients, more so than our new patients, but I would always rather see you to say something looks okay than the other way around. Don't wait. If you're concerned about a skin rash or a skin lesion, come see us sooner rather than later.
All right. Dr. Tom Scharnitz, thank you for your time today. We really appreciate it. I learned a lot. Great information. Again, dermandlaser.com for the Dermatology and Laser Center of Charleston. And this has been the Charleston Women Podcast.
Thanks for spending time with Charleston Women Podcast. Please like us and follow us on whatever platform you're using to access Charleston Women Podcast.